Here is a list of do's and don'ts that states should follow to put you and your human rights front and center of any response to COVID-19. Don't discriminate. States must guarantee access to tests, healthcare, and possible vaccines to all. Measures of isolation should be legitimate, proportional, and should not target specific vulnerable groups of people. Don't leave vulnerable and most at-risk groups behind. COVID-19 is not an excuse to deny asylum or forcibly return people to danger. States must grant protection and access to healthcare to all people in prisons. Don't repress or use excessive force on people. Physical distancing, curfews, quarantines, and limits to travel do not give security forces leeway to beat, shoot, or harass people. Don't censor or restrict access to evidence-based information. People have the right to access evidence-based and accurate information on the pandemic. Healthcare professionals, journalists, and human rights defenders must freely provide information without fear of censorship. Do guarantee access to sanitation and healthcare. Governments should guarantee access to medicines, healthcare, and other basic needs, including adequate shelter, food, water, and sanitation. Do guarantee workers' rights and social security to all. Governments should widen access to social security, such as sick pay, healthcare, and parental leave for those unable to work. This is especially important for workers who live day to day and people who cannot work from home during periods of quarantine, such as caregivers, manual workers, domestic workers, and sex workers. Do ensure a gender focus. States must take steps to mitigate the increased risk of violence against women and girls at home and the limited protection available for them in contexts such as quarantines, curfews, and travel restrictions. Do protect people's right to privacy. Governments should avoid implementing any surveillance or tracking on people, resorting to such measures only after strictly meeting the tests of being legitimate, proportional, and necessary. Putting people and their human rights first is key to overcoming this pandemic.